With access to care, another important issue here. In Charlotte, we have a lot of choices to see a doctor. It's not a problem to find one. Those choices, though, become more limited as you get further into our rural counties. Over the last year, 18 rural hospitals across the country either closed or converted to an operating model that excludes inpatient care. That's according to a new report done by the Chartis Center for Rural Health. Hundreds more are in danger of closing because they can no longer afford to stay open. Main reason is that insurance companies pay rural hospitals much less than their big city counterparts. It's increasing the number of care deserts across the country. That's where most people need to drive more than 30 minutes to reach the nearest hospital or primary care provider.
The emergency department isn't always the most appropriate setting, and in a lot of rural areas, that's the only alternative to primary care when there's access problems.
So let's take a closer look at what this means really closer to home. According to the data here, this comes from GoodRx. 82% of Alexander County residents drive 30+ minutes to the hospital. 97% of Anson County residents drive that distance or more for primary care. 34% of Stanley County's population lives in a hospital desert, while 24% of Rowan County's population lives in one as well. Now, South Carolina, 23% of York County's population lives in a hospital desert. That number in Chester County, it rises up to 37%. And in Chesterfield County, take a look here, you can see it pop up. 70% of folks live at least 30 minutes from a hospital. That can be a major issue in emergencies where time is of the essence. Think, for example, about labor and delivery.
Every bump that could be felt on the road, I felt it. And just having to breathe. I remember we saw the signs for it for the hospital, and I remember feeling that need, like, I have to push. And I'm like, I do not want to have this baby in this car.
Experts are concerned about the numbers because rural communities tend to have higher risk of negative health outcomes. CDC says rural residents have higher rates of cigarette smoking, high blood pressure, and obesity. They also have higher rates of poverty and are less likely to be insured. The lack of access to care only makes all that worse. And a big reason for that lack of access, it is a struggle to recruit doctors to practice in more rural areas.
I've had a hard time recruiting physicians. I've tried now for 18 years. If it's difficult because there's not a lot of job opportunities for their spouses a lot of times, unless they're affiliated with the university or with the local plants.
What do you think it would take to get more doctors in rural areas, even like here?
That's a good question. I know when I came, we got a rural health stipend, so they helped me pay off some of my student loans for the first 4 years I practiced, and that was really helpful.
There are other options for access to care, like telehealth, where people can see a doctor virtually, but many rural communities are also dealing with broadband issues that make internet connection more difficult. Meanwhile, the South Carolina Institute of Medicine and Public Health has an action plan that they say will improve rural health care. First, they want to ensure care is within 30 miles of a person's home or work. Second on their list, expand reimbursement programs and pay for those who work in rural areas. And third on the list, address transportation issues and barriers for high-risk patients. Keep in mind, though, this group is a nonprofit organization, so whether their suggested plan gets adopted into policy will be up to lawmakers.